Okay, all right. Okay. All right, we are live here, so welcome. Okay, all right, good to see everyone. It's about 10:34 p.m. We're just chilling. Been a pretty productive day so far, actually. So Wednesdays are my big patient care days, so that's where I see the majority of my patients. So I just stack them all, and that leaves other time to work on my business. That's been a very productive thing that I've adopted, where I try to take care of all like one type of thing on one day, for example, patient care. And then other days are when I take care of other things, things in my business. So yeah, today was big patient care day, but yeah, big promotion for our coaching program too. We went from yesterday, literally, we went from 90 members to 102 members today. So growth has been skyrocketing, crazy. Uh, and I really think it's picking up a lot of momentum too. So yeah, I've been very exciting to see that. So Jay Shweezy says thoughts on Lexapro on day 4, kind of dizzy. Yeah, I like Lexapro a lot. It's one of those antidepressants that is very easy. It tends to have the least side effects, so I think that's nice. Sometimes you can, of course, have little side effects, but they usually go away within the first week. So if they go away pretty quickly, then I think what you need to do is just you just gotta stick with it. Like give it like a week or so. My cat's like walking around here, so I see her prowling. I'm the only one who's at home, so I think she's extra attached. My parents went on a trip. So, topic today is just a casual Q&A. Yesterday we did a coaching call for my community, so I showed that. But today's more of a casual Q&A. I have severe OCD. Can you advise me? Yeah, so basically for OCD, what you need to do is do this thing called exposure and response prevention therapy, where basically you get exposed to the things that are bothersome, but then you don't respond with the right compulsion. So that's how ERP therapy works. Uh, so you do that, but you also often need high dose SSRI, especially if it's a severe OCD, and N-acetylcysteine too. Any thoughts on non-psychiatric disorder doctors prescribing off-label for conditions? I mean, that's fine. Off-label is such a confusing term. That's actually a good topic that I should include in my coaching program. Basically, what off-label means is that the FDA or the drug company sought approval for that medication and they proved X study to do it. That's all. It's just a pure marketing thing. So once they seek an approval for something, then they don't care because now they can market it for that thing. So, but it doesn't mean that it can't be used for other stuff. So, like clonidine, for example, is used off label for ADHD, but it doesn't have the FDA approval because they got it originally for blood pressure. And then studies down the line found that it was helpful for ADHD. So, that's the key about the FDA labels, is that that's what it truly means. It doesn't really mean much because like they do studies after the fact plenty of times. What medications would be the best option for extreme panic attacks and or agoraphobia? Maybe a benzo if it's like super extreme. I mean, ideally I'd start with an SSRI, but for example, I had a patient today. He's tried SSRIs and it didn't work, and he uses Ativan, and Ativan makes a huge difference for his agoraphobia and stuff, and his panic attacks. So that's what works for him. I refuse to take any more SSRIs. Yeah, you don't really have to. It's up to you. Keep doing you, man. I appreciate it. Thank you. Hello. Good to see you. Good to see you. When do you know you could transition off your SSRI? Usually we like to wait about 6 to 10 months or 6 to 12 months. And then once things are good, 6 to 12 months, that's when you can come off. That's the goal. Should I be afraid of Lexapro? Currently on 0.5 Xanax extended release, but I feel like it's not doing anything. Yeah, that's kind of a low dose. Maybe you need, that's like a starting dose, so maybe a higher dose is better. I just don't like Xanax personally. I just think it's very short acting, so unless it's for like a short duration, then it's not the best kind of things. Karzin says beta blockers or benzo for uncontrollable rage. Probably an antipsychotic, to be honest. I don't know if those two will be strong enough. When is your clinician forum? So I do that every Tuesdays. So every Tuesdays, that's when I do my coaching, and so that's when you can see my my coaching in action. So we have a coaching call every Tuesday at 8 p.m. Eastern Standard Time, and so I live stream that call so people can see. What is your favorite benzo or preferred? Klonopin for the most part, and then Ativan. Valium is useful for tapering. I have pure O. I am taking already Sertraline 100, Clomipramine 75, and 200 milligrams Seroquel to sleep. So that's a pretty good combo. But Sertraline can usually go up to 200 or 250. So that's what I would try to optimize. What to expect at the new patient appointment? So pretty much at a new patient appointment, what you need to expect is your psych's going to ask you a whole bunch of questions on your past history, your symptoms, the past diagnoses you've had, medical history, go into detail about what's going on, the timeline of your symptoms. So they're going to ask you all of those questions. And that's your time to be honest, because you definitely want to be honest with your psych, because they're there to help you. And like, so if you're dishonest with them, then they won't be able to help you the fullest. Can iron deficiency make depression and anxiety worse? Yes, 100%. I had this patient who had a severe iron deficiency. She was getting hemoglobin transfusions, and so I was helping treat her with modafinil. But really, the problem was the iron deficiency, and so yeah, like she was having all these depressed kind of symptoms, and turns out that it was all energy due to modafinil. So definitely an issue. Antipsychotics are not the same things as SSRIs. No, those are different classes. I take Wellbutrin. What can I take to bring my heart rate down? Propranolol. That's usually a good combo. That can help with the anxiety too. Yeah, I can't increase the dosage because my QT levels is high. That doesn't necessarily mean you end up in torsades. Zoloft doesn't really cause torsades. Just saying hi. Hi, Danielle. How are you? Is there any emergency meds for psychosis? Yeah, it's just antipsychotics, emergency antipsychotics. High doses of Lexapro help OCD. They calm down the ruminations from high serotonin. I'm drinking a ginger and turmeric tea. The glasses, these are dry eye glasses, so they help me with my dry eyes. Is propranolol a cardiology med or a psych med? So it's traditionally it was a blood pressure med, but it's not that effective for it. Like, so no one really uses it for blood pressure purposes. I mean, like they do, but more rarely. But then they found that there's a lot of benefit for anxiety, so that's what it's used for. So it's used for anxiety. It's used for POTS as well too, high heart rate, that kind of thing. What are your thoughts on lithium long-term use? Lithium, you always have to weigh for risks and benefits. So if the patient has a benefit, and so it's definitely useful for bipolar. It's one of the best meds for bipolar, but long-term risks are pretty intensive. So I try to taper them off of lithium long-term or to switch them to something else. Yeah, all my details are in my bio. So if you check out my bio, that's where all the details are. Can I use your lectures and PowerPoints for CEUs? So not yet, but I want to do that. I want to incorporate CEUs into my lectures pretty soon. That's a goal. Chelsea asks, what's the best for panic disorder on a flight? Best medication or therapy? I assume medication. Generally, Xanax is good because it acts quickly and it doesn't last that long, and most flights are not that long either. So that's why I like that. Yeah, but yeah, all details are in my bio. Yes, exactly. If you want to book a consult with me, that's the best way to do that. At what age can NPD be diagnosed? My 8-year-old has DMDD, but I'm concerned it's more, yeah, usually more adult. But when they're kids, DMDD, ODD, those are the common diagnoses. Albuterol for anxiety, that's not really a thing. Can you take Ativan for a flight? Yeah, you can. You can take Ativan for a flight too. I was wondering if Adderall XR and Wellbutrin XR would be a good rep. I already lost it. Would be a good combo for ADHD and depression. Yeah, that's definitely solid. That's very common. Thank you for the heart eyes. How do you differentiate between PTSD and OCD? Rip, I already lost it. Rumination causes high anxiety and panic attacks. Yeah, those are very different though. OCD, you have specific intrusive thoughts, usually repetitive ones and irrational ones. PTSD is more thoughts that you're going to get harmed, people are out to get you, and they tend to center around more trauma, and they tend to have a lot more like hyper arousal. It's like you're always on alert for things. OCD doesn't really mean that you're always like on hyper alert. Right, Terry, I'm not sure what that is. What's the generic for that? Rip, all these questions are coming in hot. So yeah, I would definitely recommend subscribing, because if you subscribe, then I'll be able to see your questions and answer them in more like focus too, because they're just kind of scrolling, and so yeah, I'll be able to answer your questions in more quickly, and I'll be able to prioritize them by subbing. Do I drink caffeine? Not really. I mean, like if I don't sleep well, then yeah, but I try not to because it really affects my sleep. Like it really fucks up my sleep. So I don't like to drink caffeine unless I absolutely need to. Yeah, I find I just have nice deep sleep without caffeine. So this is turmeric and chamomile tea. How do you feel about antiretroviral medicine? Do they cause long-term damage? I'm not too sure. I don't know that much about antiretrovirals or antivirals. Also, gabapentin is good for my nerves, but does not help my mood. Yeah, exactly. It's not really a good mood med. It is meant for nerves and seizures and some like alcohol stuff. Yeah. Does guanfacine reduce the effects of Vyvanse? It can reduce some of the intense like stimulation of it. Yeah, but it's I use it more to help with the anxiety. Can clonazepam work for a flight too? Chelsea asked. Yes, of course. Yeah, they can all work. All the benzos can really work. I clonazepam I like if I do need like long-term relief. So I like it better for like a chronic anxiety. But if I just need it for like a situational, then I want something short-term and like hitting quicker, not lasting that long. Should I start taking Phenibut? Definitely not. I had a patient who was addicted to that shit, and literally like he was able to come off of alcohol, but he wasn't able to get off that. Is it common for bipolar disorder to also have a personality disorder? Yeah, they can I was actually talking about this in my NP coaching community yesterday. We were talking about personality disorders and how to deal with them. Uh, and BPD and bipolar tend to go very hand in hand together. Do you take on patients for med management? Yes, yeah, I do. So the best place to see that is in my bio. That's the best place to see it. Can ADHD be diagnosed with a brain biopsy? Definitely not. So a biopsy is when you're dead. Like that's when you take an actual physical specimen of your brain. So that's definitely not a thing. Like that doesn't happen in real life. What do you suggest for sleep? I can't sleep since I quit. Green. So for sleep, I would definitely suggest. I mean, there's a thing called CBTI, which is like incorporating good sleep lifestyle habits into sleep. So that includes like not drinking that caffeine, not using screens an hour before bedtime, not uh, keeping your room cold, taking a warm shower beforehand, sleeping at the same time each day, waking up at the same time each day. Those are all the basic sleep hygiene techniques. And then, but medications wise, you can use hydroxyzine, you can use trazodone. I don't really like melatonin because I think tolerance builds really quickly. So yeah. Genetic psych drug testing. Do we need an MD to order that? Yeah, usually an MD would order that, or a provider, but like someone that you're working with. Diana asks, for vitamin D of 26, need 50,000 IU weekly. 26 is pretty good actually, like because remember like low normal is 30. So or if their vitamin D is 26, you could just do 5,000 a day. Vitamin D is like, it's like you can overdose on it, but it's hard. But yeah, you could also do the 50,000 for 8 weeks and you'll be fine. So yeah, that's a good question. So Diana is one of our members of our community. So I definitely know her. I haven't vaped in 2 days and I am cold. LOL. Congrats on 2 days sober. The cold is definitely a thing. Like I've been cutting a little bit, and like from a like bodybuilding sense, and I definitely feel more cold over the last like couple weeks since I've been doing that. And I've been fasting too, so I definitely feel cold in the morning, and then since I eat one meal a day, I feel really cold in the morning, and then I eat my meal, then I feel warm, and then it's like a slow cool down after that. Insurance won't cover 2,000 IU. Yeah, then just do whatever they cover. But honestly, over the counter vitamin D is so cheap too. Like the 5,000 IUs, you can get like a 90-day script or 90-day over the counter for like $15. So pretty cheap. Okay, Ahmad says, even when I take my Addy, sometimes after I can't seem to start my homework or do stuff. Even after I take my Addy, sometimes I can't seem to start my homework and do stuff. Yeah, of course, it's not like a magical fix, right? The meds are just a tool. So it's not like it'll magically fix your ability to do homework. You still have to want to do it. You still have to get rid of distractions. You still have to be productive. You still have to have a good night's sleep. Your brain still has to be like firing. Like now, even if I took Adderall and I try to work on something, like I couldn't because like my brain's dead. I've been up all day. But if I do it first thing in the morning, it's a lot better. Desiree says, hello, a PMHP from MDOC. Nice, welcome. Good to see you. What are some other substitutes for ADHD meds? I used caffeine for a while, but it's not helping. Other substitutes for ADHD meds. I mean, you can use supplements like L-tyrosine. You can use omega-3s. If you're more hyperactive, magnesium can help. Yeah, green tea extract can be helpful. Phosphatidylserine can be helpful for memory. So there's some choices. It's weird because it's hot out, but I'd be cold. Yeah, that happens to me too. Why aren't constas a thing anymore? What do you mean they are a thing? Can you telehealth if patient is in nursing home setting? Yeah, a lot of people do that. It might be just harder because people in a nursing home setting have more medical stuff, and like that could sometimes get missed. When I take my pain meds, Ahmad, thank you for the sub. When I take my pain meds, they make my mouth very dry. What should I take besides more liquid? I mean, this is getting into complex territory, right? Like if you're on pain meds, like there's some stuff that's going on, so I don't know what's happening underlying, right? Uh, can POTS mimic panic disorder and severe anxiety? Yeah. So basically with POTS, the thing is like when you get up, stand up quickly, then your heart rate starts racing a bit. And so it's called postural orthostatic tachycardia syndrome. Postural, like your pose, right? You're standing. Um, Orthostatic means like the blood pressure related. Because like orthostatic hypotension is like positional. When you're laying down, you're fine, but then when you get up, that's when your blood pressure drops, and then tachycardia is increased heart rate. So when that heart rate increase happens, it can mimic panic disorder and severe anxiety. Yeah. So that's definitely a thing. Do you work with the VA? I used to. I don't work with the VA now, but like when I was in my residency, we would do every Mondays at the VA. What to do if ADHD meds cause high blood pressure or tachycardia? You can just reduce the dose. That would be one thing. You could also use something like a guanfacine, clonidine, or propranolol. That would be another thing as well, too. I'm numb after mandibular jaw surgery. Should I remove the plates? I cannot comment on that, my friend. I don't know about that stuff. What do we do at the VA? This was outpatient, so I worked in the outpatient department where I was a resident. Lots of options, yeah, because carbamazepine cause weight gain. It can. It definitely can, yeah. Is citalopram the best SSRI? No, I don't think so. There's no like best SSRI. Different. They just have different advantages in certain situations. I like Prozac personally, um, but yeah, everyone's got their own thing. What's good for high blood pressure? I mean, I'm not a blood pressure person, right? That's usually what a PCP or a cardiologist would handle. But for us in psychiatry, we have to be aware of blood pressure because certain meds decrease blood pressure, like guanfacine, clonidine, propranolol. Those are the top three. So sometimes if a patient has hypertension and they have anxiety, I'll use that to my advantage and use one of those. Uh, so whereas other medications increase blood pressure, like Effexor or stimulants, right? They are more likely to increase blood pressure, but they're not as likely to increase the blood pressure as the other ones are to decrease blood pressure. Well, Butrin didn't work too well. Her doctor made too many changes. Do you mind people spamming in the comments? Disrupts everyone. Yes, oftentimes I miss questions. Do you practice in Virginia? No. Which medicine is prescribed for emotional pain? There's no such medication as prescribed for emotional pain. It just depends on what the underlying conditions are that are going. What do I do if meds stop working? Try different med. I mean, it's so hard to say, right? Like it's so hard to say off of an individual situation like this. So, yeah, that's where I recommend booking a consult because then if you book a consult, then I'll be able to see your situation in more detail, right? Rather than just going off purely alive. Can you help someone with NPD? No, you can't help someone. You can't make someone drink water, right? You can lead a horse to water. You can't make him drink. So the only way you can make that horse drink is if the horse is very thirsty and they're in the desert and they haven't drank for like hours on end and they're not going to drink for hours on end. Basically, the pain becomes so bad that they have to drink. So it's the same thing for the NPD, right? You can't make someone change. They have to want them change. And the only way you can make someone, you can't control other people's behavior. You can only control your own behavior. Never forget that. Which anti-anxiety meds? Rip, I already lost the question. Oh, which do not impact tinnitus? I'm not sure. None of them are really ototoxic, so you should be good. Can guanfacine cause dizziness or fogging as upon intense exercise? Yeah, definitely. It can lower blood pressure. Meds also stopped working. They now on California rocket fuel and just okay. Okay, well, sounds like it's working. Thoughts on venlafaxine? Yeah, it's good. It definitely packs a punch. That's the California rocket fuel she's talking about. Venlafaxine plus mirtazapine. I don't know why it's called that, but whatever. But it's good. It packs a punch. Which antipsychotic causes least amount of weight gain? Probably Abilify or Latuda or Vraylar. Yeah, those are some of the less weight gain ones. Mirtazapine made me so fat. Yeah, it definitely can cause a lot of weight gain for sure. Is it too low for an adult? The doses are very weight dependent. Seroquel, yeah, Seroquel definitely can cause weight gain, and it's very mood stabilizing too. Caplyta, people lost weight in clinical trials. Yeah, Caplyta is good as well too. Yeah, that's a very weight neutral one. What would you prescribe California rocket fuel for? Just severe depression or anxiety. Mirtazapine made me so fat. Yes, it can definitely happen. Light flex in the background. Let's go. LOL. Advice for unmedicated ADHD, such as vitamins. Getting a night of sleep. Making sure your productivity habits are good. Reducing phone time. Because phone pretty much gives you all bad dopamine. Getting on omega-3s, L-tyrosine. Supplements like that. Exercise, yeah. Where do you think the field of psychiatry could improve? So this is Dr. Joseph here. I know what your answer would be, but I understand where you're coming from and your views, right? So my answer is that I think the diagnostic system is not very clear. I was actually just talking about this in my coaching program yesterday, where let's say you have a diagnosis of concentration. Well, concentration could fall under anxiety. It could be a depression concentration problem. It could be an ADHD problem. Like literally yesterday, we were talking about diagnosing between or distinguishing between concentration anxiety versus like an ADHD anxiety. And he gave the example of a patient who came in. She said 18-year-old female. She was working with her dad, entrepreneurial stuff, but she couldn't really do it well. So she was getting anxious along that time. And so like I was trying to spend the interview trying to distinguish, okay, is this anxiety related or is this ADHD related? And I realized, okay, I settled on it being ADHD related. So we prescribed her ADHD medication and she got better. And so, and that was a case where the treatment was diagnostic, right? The treatment of her getting better on ADHD meds told me that, okay, this is likely more primary ADHD rather than anxiety. So to answer your question, my friend, I believe that the DSM-5 system could be improved because right now it's just based off of a collection of symptoms rather than a true diagnosis, like a neurobiological basis that we have. Because then once we have a neurobiological basis, then we can have treatments that are targeted more towards that neurobiology rather than treatments that are targeted towards just a collection of symptoms. Diana says, is there cases you would dose a stimulant at night? Dr. Joseph, thanks, Dr. Agam. Yeah, of course. Send me a DM. Let's definitely chat and connect sometime. Is there cases where you would dose a stimulant at night for a good start in early mornings? Yeah, so I actually did this with another patient. So I prescribe Jornay, and Jornay PM, basically it's a stimulant that hits about 10 hours after you prescribe it. Comes in doses of 20, 40, 60, 80, 100. So they take it at night, like let's say 10 p.m., and then they wake up immediately in the next morning and they feel it about 10 hours later. So she would say, I would take it at night, and then I would I would wake up and then immediately like feel alert, immediately feel the stimulant kicking in. And that was like super helpful because for her, starting the day was really hard. And so she had tried Vyvanse before, but Vyvanse just took a while to kick in. So that's why it worked. Ate and left no crumbs. Yeah. Yeah, I got a little fired up there. Do you ever prescribed MAOIs? I've rarely prescribed MAOIs, maybe like once or twice. Like, that's about it. What are you supposed to feel being on 30 milligrams of Vyvanse? What if you feel no difference? 30 milligrams is a small dose. Like, that's a starting dose. So that's probably why. Oh my God, same. Thank you. Yeah. Do you think ADHD has some deeper reason? Yeah, so ADHD tends to stem from, sorry, I got distracted. ADHD tends to stem from a frontal lobe deficit, basically that there is decreased activity or decreased norepinephrine signaling, dopamine activity in the frontal lobe. And that's why stimulants help the frontal lobe. And that's why paradoxically they can calm people down, is because they stimulate the frontal lobe. And so when you stimulate the frontal lobe, this is the part of the brain that does executive function, clinical decision making, like critical thinking. Basically, it's like your CEO of the brain. It's the conscious on your shoulder, so it's able to make better and better decisions. Bruh, everybody got ADHD now. Yeah, I think that there's definitely an overdiagnosis that's going on, secondary to social media apps. You are cute. Thank you. I appreciate that. I like your mug. Yes, you'll have to thank my mom for that one. Can SNRIs get rid of SI thoughts? They can. Yeah, I mean, any medication can, but sometimes they can worsen at the beginning too. So you just got to be wary of that. Typically, you got to treat what the underlying condition is. I wish I could record these lives. Yeah, so actually, I'm doing them on YouTube, and then on YouTube, they will automatically save onto the platform. So you can definitely check out my YouTube, and if you want to watch the lives. Do you have a favorite soapbox issues you are passionate about? Ooh, do you have a favorite soapbox issues? Yeah, so basically I always say on this live, right? So the reason I call my whole practice Level Up Psychiatry is because I think that life is a video game. And so in a video game, you start off with a certain character, and each character starts off with specific stats, right? You have your attack stat, your defense stat, speed, whatever. And so like in a game, you do that, and then as you progress in the game, you level up your character, your stats get better. And because your stats get better, your gear gets better, you're able to fight stronger monsters, fight stronger bosses, and you're able to accomplish stronger missions. Well, real life is the exact same thing. So, in real life, every character, like, in your character creation screen, right? Every character starts off with different attacks, defense, whatever stats we have. So we all start off with different mental health stats, different physical health stats. We start off with different social ability stats, different physical stats, right? And so those are all stats we start, but we can level up those stats in real life. And then as we level up those stats, we get better and better, and we're able to fight stronger and stronger monsters. We're able to accomplish more. We're able to physical health, right? Like you start lifting more, then you can lift lot stronger weights. Socializing, you push yourself and out socialize. Before, you might go from not being able to go to a party or a social event to now you can become the life of the party and attract the person of your dreams because of your social life. Looks, you might not look that good, but if you work on them, you get better, you level up. Your charisma, right? You might not be that good, you level up. Your career skill, right? Psychiatry, right? 10 years ago, I didn't know jack shit, but I leveled that up, and now here I am on live sharing this stuff. So, I think what people need to understand that you're not always stuck in the place that you're in, because if you treat it like a game, all you got to do is just keep leveling up. And that's why I'm out here working all the time, is because life is a video game, and like this shit's more fun. I love gaming, but like this is literally a game. Like working on my business, working on my goals, like that's the game. It's always trying to level up. I understand, but not everyone starts with the same base character. Yeah, of course. No one ever said that you start at the same base character. Of course, everyone starts in different places, but you work with what you got and you level up, right? Either it's you make excuses, like Ryan, like what you're doing, my friend, right? Yes, everyone, does privilege exists. Yes. Are you going to change that? No. So either you can be a victim and complain about it, or you can say, hey, this is the situation. I'm going to level up, right? That's how it goes. Everyone has different privileges and different like things that they're not good at. I'm 5'6". I'm brown. These were insecurities that I had in high school. I felt like girls didn't like me. I felt like I was not cool. People didn't want to be my friend, right? Because of those insecurities I have. I remember going into high school and we had grade 9 gym class. And in grade 9 gym class, the teacher showed us, we took us to the weight room and he showed us a barbell. I was the only kid in that class who could not lift the 45-pound barbell. Like, yes, I agree. No one starts with the same base character. I was the only kid in that class. And now I can, I mean, I am not the best bencher, but I can certainly bench press now. So why? Because I chose to level up, right? That's how it is. I had some strengths, some weaknesses, and you level up your weaknesses to become the best well-rounded character you can be. I felt like I wasn't social. Now I'm here on live yapping to the world, and I built a social media following. No one taught us in med school how to do social media, how to do business, right? It's just science. But then these are skills that I leveled up outside of my traditional education to be able to do this, to be able to create a business, to be able to get on live and speak and be social, create a channel, all of this, to have it go viral, all these things. And so that's the message that I want to spread to the world, is that, you can always level up, and that's how you're ultimately going to get success in life. Yeah, that was definitely that was definitely quite the yap. My LOL, my game's frozen. Yeah, I think you gotta download the new patch notes. How you doing? Hey, Murray, good to see you. Good to see you. In your defense, 45 is too heavy. Yeah. Do you think there will be a cure for narcissism? No, narcissism has a huge purpose. Right? It's everything in life is a spectrum. It's not like either you have this or you don't. It's to what degree you have this. You know, if you have no narcissism and you're complete humble, well, then you are like a monk and you don't want any kind of worldly possessions and whatever. Like that's great, and that's like, you found enlightenment. That's awesome. But you're not going to be a rich, successful mother effer if you are that on that side. On the other end, right, you might have someone who's extreme and they don't care about any relationships but themselves. But that person they might also be a complete degenerate, but they could also be successful too. So I think that you need narcissism because that's what aspires you to be successful. That's what aspires us to look better, to act better, to think better. We need that narcissism in our lives. Too little and you don't want to do anything. Obviously too much and you alienate all your friends around you. So it's like having the healthy level of your narcissism is the key here. Wise beyond your years. Thank you. Are you single? Married to the game. Married to the game, my friend. What do you recommend for social anxiety? So you have to get exposure for social anxiety. That's what you got to do. That's the main thing. So I remember when I was in college, right? Like I was scared around girls. I was scared around socializing. All the popular kids. Like when I was in high school, I only hung around with like I had like a nerd circle. It was all like the science kids, and we would all sit around the outside the physics room and just like eat lunch there. It was either that or I would play in the chess. I would eat my lunch in the chess room playing chess with like a couple friends I had, or I would go to the computer room and eat in the computer room, and like play like a mini golf, like whatever computer games there were, with a couple friends. So like those are the three things that I did in high school. And when I went to college, I was like, no, I got to change this. I cannot be like this anymore. And so that's when I went and I joined a fraternity. And that pretty much like rocked my social world. I was like, what is this? Like parties and girls and, uh, these like cool guys. And like, what the heck? Like, where is this coming from? And so when I felt this, when I had that, I realized that, okay, that's how I overcame social anxiety. Was I just got exposed to that whole situation, and then I just got better and better at it. And so now it like it doesn't bother me, but that's like a journey that I had to overcome. So you have to expose yourself to that situation and then show yourself that you can handle it. Hi, I'm a primary care pediatric NP, MHS. Love your TikToks. Thank you. I hope they are helpful. I hope they're helpful. Yeah. We actually have a couple primary care NPs in our coaching program, actually. So it's mainly marketed towards PMHNPs, but we do have a few FNPs too, because they're trying to learn psychiatry as well. And actually, we just reached 100 people in our coaching program today. So like the growth's been crazy. Yesterday morning we were at 90, and now we are at 100. So I launched a promotion to help promote it, and basically it's like half price. If you get the yearly, it's a full 50% discount. And I was gonna do it from from 90 to 100, and I was like, okay, well it's probably gonna take like 5 days or so, right? We were getting 1 or 2 people a day, but literally 7 people signed up yesterday, and I'm like, holy crap! And then I think today 5 people signed up, so it's definitely growing. And so I was like, okay, you know what? Like I'm gonna leave it open until midnight tonight, and then I'm gonna stop that. So if you've been thinking about it, right? If you're an FNP or a PMHP and you really want to learn psychiatry, you feel like school hasn't taught you, you haven't really learned in the real world that much, you want to be able to staff cases with a psychiatrist, uh, if you want to have a community of like other colleagues to lean on and to work with, then now is definitely the time to join, because tonight I'm gonna move it back to its original price. So yeah, like literally we went from 90 to 100, and I said that at 100 I was going to cap it, and so I will cap it because we've just reached 102 today, but I'll do it tonight at midnight. So it's 11:17 right now Eastern Standard Time. So if you want to join, now is the time to join. Yeah, all the info is in my bio. So if you check out my bio, that's where all the info is. Or here, actually, you can what you can also do is here. Let me figure this out. Yeah, so you can also just send me a message too, and I can send you the link. So either check out my bio or send me a message, either or. Going to content creator events help me out with social anxiety tremendously. Yeah, exactly. Where do you live, Chelsea? That's huge. Going to these content creator events. Basically, content creation is the ultimate. I think it's one of the greatest ways to deal with social anxiety, because and like being judged, because you put yourself out there. Like now I'm out here, uh, people are like talking. I get made fun of. Right? People call me a pill pusher and drug pusher and uh like big pharma lover, or like I don't know what I'm talking about. Like people will talk like random shit, right? So you just get used to dealing with that. And everyone who puts themselves out there deals with crap, right? You've probably seen it on these lives too if you're regular here. So yeah, that really helps build up your confidence too. So you're telling me there's a chance to stop. Okay, gonna screenshot that one. Thank you. Thank you, Lamori Gaming. I appreciate that. Do you feel PharmD are starting to overstep, like asking for copies of notes to fill a stim? That's crazy. Yeah. I mean, I somewhat get it because of the stimulant shortage, but not fully, right? I also think that sometimes therapists are starting to overstep when I'll have patients come to me and they'll be like, "Oh yeah, my therapist said that I should go up on my ADHD meds or my antidepressant." I was like, ugh, okay. Or they say like I should start Adderall, for example, and I'm like, oh my god, now I have to go enter in this discussion with you. And it might be the right choice, but it might not be the right choice, right? And it's taking away valuable appointment time. Joining the army got rid of my social anxiety when I was 18. Once I got out, I joined engineering school, joined a sorority, ended up being the most outgoing, which was funny. Yeah, exactly, exactly. See, I think everyone's got that like that story. Thank you, Lavita. You're so knowledgeable. Yes, always. She's always spitting game. Charles says Toronto, Ontario. Oh, nice. I grew up in London. What means for you married to the game? Basically, if married to the game means married to the mission. So my mission, right? Like I want to basically my mission is life is just to keep leveling up. And like that's what like I wake up and like, okay, what are we gonna level up today? Because when you play a game, right, you play a fun of a game is like when you play it, you just keep playing and you get better and better at the game. And the good games you don't really want to end because you're just having so much fun playing and you're always getting better. If a game is too easy, then it's boring. But if it's too hard, then you don't want to play because it sucks. So you have to find that sweet spot. And so every day I feel like I'm just like trying to work on something. Like today, I was I saw some of my patients today, so I was reading up on some of them and like trying to figure out new ways to help them. Like one of them had some weird labs come in, and so I was doing some research under the labs. One of them actually had POTS, so I started learning more about POTS today. So like leveling up my psych skills there. And then tomorrow I'm going to be recording a bunch of content for my coaching programs. I'm going to be leveling up our coaching program tomorrow. So yeah, every day is just a day to level up. Like I've already prepared a bunch of lectures for it. So I'm going to be recording them. And yeah, I've been writing with the stuff that I want to prepare. Yeah, what am I going to record? Yeah, I'm going to be recording on bipolar 2. That's going to be a topic. I'm going to be recording some case studies that I have as well too. Hit a month on Lexapro Sunday and hit 15 milligrams. Yeah, I mean, it's hard to say, right? Lexapro can take some time, but I think that getting fixated on this is not helping your case either because I think, because I noticed that you come in a lot, Melissa, and ask about the similar thing again and again. So I can tell you're very fixated on this one topic. And so being fixated on this one topic is not going to be very helpful. Doc, how old are you? I don't see any grays. I am 31. I can't find your YouTube page. Yeah, just search my name, first name, last name, and you should be able to find it. How important are thyroid blood tests? Definitely important. Thyroid can contribute a lot to depression, anxiety, for sure. Definitely important. When are you going back to New York? Asking for a friend. LOL. Do I know you? That is my question. I will be going back to New York in a few weeks. But really, I came here was because I wanted to really work on my coaching program. Um, yeah. So of course, you want to feel better, right? But remember, feeling better is just not relying on the meds too, but it's also relying on your own individual actions to improve too. And so I think one of those actions is like changing where your focus is. So instead of fixating on why things are not good, which is what we call a negativity bias, you want to be focusing on things that you can do, things that are good in your life. And that can help as well. I'll have to send a message to a member in our community. Perfect. Love you. Oh, nice, Monica. Love you too. Clomipramine has helped my son's OCD, but not in anxiety. Any thoughts? Usually OCD and anxiety are together. And so if one goes hand in hand, then yeah, it's usually weird that it doesn't help one but not the other. Your coaching program is awesome. Steve, I appreciate that. Thank you. I will screenshot that. I had a question like that on my exam that, okay, if I'm taking Adderall, it's making me irritable, what do I do? You probably need to decrease the dose. That can happen very easily with Adderall. I actually just made a video about this. The right starting dose is so important. If you start too high, then it can definitely cause anxiety. If you start too low, then patients don't feel like they get any benefit from it. So the right starting dose is so key, but sometimes it can go away too. Also, switching to a different class, like using the methylphenidate class, can be helpful. Adderall tends to be, that's the amphetamine class, and that tends to cause more irritability and anxiety than the methylphenidate class. Can I join the coaching program if I want to learn? Of course, that's the whole reason to join it, is to learn, right? That's literally the whole reason. Yeah, like we have lectures on all the different diagnoses, all the different medication treatments, but I think the best learning comes from the Q&As. So, every week people ask some really complex questions, and so we go through them and we answer all of them, like case studies, different nuances. Like yesterday we talked about BPD versus bipolar, talked about a complex case for an 11-year-old kid who has autism, who's on and who's on risperidone and clonidine or guanfacine and Zyprexa, on like one or two other meds too. I think hydroxyzine or trazodone, and like we're trying to work to out like, okay, how do we treat this patient to really make sure that we address their irritability, their agitation, their eating. So it's a complex case, right? So that's the advantage you get, is that you can join. I mean, I'm not a clinician or provider. Okay, then it's probably not for you. I wouldn't join it if you're not a provider, because you're not going to get much value from it. Like it's meant for providers, like at that higher level. So if you're not a provider, it's not like a general education course. That's where I think more of the videos are helpful. Awesome. Chelsea says, I think I subbed correctly. Awesome. Good to see you. Yes, she has. Yes, Toronto content creator. Yeah, I went to a content creation event in New York, actually. It was a Stanley event, like Stanley Mugs. They were sponsoring a influencer kind of event. So I went to that, and yeah, they're actually thinking about changing their integrating more mental health into their campaigns. So I thought that was really interesting too. They're going in that direction. In your experience, how effective are meds like sodium valproate for bipolar? Pretty effective. They hit bipolar 1 pretty hard. What signs and symptoms would you recommend one to seek an ADHD evaluation? Basically, if you're struggling with focus, concentration, you feel like you get overwhelmed with stuff, you're not as productive as you would like to be or you think you should be. For example, I have a mid-30s lawyer client I'm working with, and so with her, we started Adderall because she had a lot of the symptoms, and she literally, like, I had my appointment with her today for follow-up, and she was smiling, and she's like, oh my gosh, like, stuff that would take me till like 8 p.m. to do, and I would be working late at night, I now get done by like 3, because I'm able to just do it way more efficiently at work. She said her boss commented that she's a lot more organized than she was before. So it can definitely, the right treatment can definitely make a difference in your life, for sure, for sure. And the best way to do that is to, if you want to work with me, the best way to do that is to book a consult in my bio. I'm diagnosed bipolar 2 and ADHD, but I don't want mood stabilizers, only ADHD medication. Can I refuse? Yeah, I mean, it's always a risk benefit, right? So you can, ultimately, as a patient, you have the right. So as long as you guys agree to it, the risks and benefits. The risks are that if you just have ADHD medication without a mood stabilizing, then you can enter a manic episode or a hypomanic episode. So that's the risk behind it. Thoughts on Wellbutrin for ADHD? It's really good. It's really good. So especially if there's ADHD and depression, it can really make a difference. What do you do if levels stay below 1500, below treatment dose, but on 1500 sodium valproate? Then you just increase it. So you can, sodium valproate is a very weight-based thing. And yeah, so that's where you have the levels to help guide your dosing. Do you recommend adding L-Methylfolate for patients taking L-Motrigine? I would add L-Methylfolate more for an SSRI. Best meds for social anxiety, Propranolol. But social anxiety is better from a other perspective, like exposure perspective. Would you recommend seeing a psychiatrist for acute panic attacks? Maybe. It depends on if you feel like they're severe enough and they're affecting your life. Beta blockers for anxieties? Yeah, Propranolol, that's the main one. Low motivation, depleted energy, but also have anxiety, panic. Is Propranolol or Buspar better for anxiety? Propranolol more as needed for physical anxiety. Buspar better for long term. I'll be flying 100% alcohol free for the first time. Nice, congratulations. Is CBT and clonazepam going to be enough? Yeah, I remember I had a patient who I was treating for flight anxiety, and she had dental, and her two things were flight and dental, and so we used a benzo for that, and it really helped her out. So yeah, no, I think you'll be fine. Yeah, I think you should be good. And then I think what'll be really nice is that once you do it the first time, then you'll prove to yourself that you can do it, and then you'll be good after that. Is this med combo safe? I'd be concerned. Abilify, trazodone, hydroxyzine, Wellbutrin, Zoloft. Yeah, actually, all those don't really interact with each other. They're all pretty different, so they are safe. What meds would you recommend for low energy levels along with anxiety? Probably Prozac. I like Prozac because it's a stimulating SSRI. Citalopram plus quetiapine, good for anxiety. Yeah, I like quetiapine a lot for anxiety too. Treatment for CPTSD, comorbidity with MDD. Any kind of SSRI. Plus, you can do EMDR as well too for the PTSD, or like some kind of calming intervention too, like yoga, mindfulness intervention. Atomoxetine for TRD in geriatric patient. I wouldn't really use it for treatment-resistant depression. Like, it could help, but I feel like there's other options, better options for treatment-resistant depression. in geriatric patients. Like I would go with, like SSRIs are good. You could also use an adjunct antipsychotic, something that has low QTC prolonging, like maybe like Abilify. Lamictal could work. That one's pretty well tolerated. Yeah, maybe Wellbutrin. Wellbutrin could be helpful because it can be energizing too. Dreading clinicals tomorrow at 6. Yes, get some sleep now. Like, I sleep 9 hours a day usually. Like yesterday, I went to bed 12. I went to bed at 1 and woke up at 10 today. So I am a huge believer in sleep. Like I feel like crap if I don't get good sleep. My Psych NP started me on Wellbutrin for ADHD, but I still need an official diagnosis. That sounds like an official diagnosis if you got started on it for ADHD. That's the diagnosis. Can Invega help with mania? It can, yes. What should I do if I'm terrified of SSRI side effects and emotional blunting, but my anxiety is so high? Yeah, usually that's when in those cases we'd start low and then go slow and then build up. Do you know anything about Prestige? Yeah, Prestige is like a venlafaxine effexor metabolite. And it breaks down from effexor breaks down into venlafaxine. Do you think the withdrawal is bad? It can be bad, yeah. It can be bad for sure. But as long as you go slow, like I have a patient we're tapering off of Effexor right now. I'm tapering her to Luvox for OCD treatment. And we got down from 225 to 150. And she said the withdrawal, the taper hasn't been as bad as she thought it would be. So, yeah. What is this difference between Venex and Venex 375? Usually XR doesn't go to 375. XR goes to 225, maybe 300. The XL goes, the immediate release goes to 375. Have question. Can these meds cause permanent damage to the body? People definitely have difficulty getting off the meds for sure. The way I look at meds, psychiatric medication, it's all just a risk-benefit analysis, right? Like they're not magic, they're just tools. And when we start a medication, basically we decide that, okay, we believe that the benefits of this outweigh the risks. And that's just a calculated decision that we make together. So, as long as we agree that that's the decision, then that's what matters. Thoughts for racing intrusive thoughts, or treatment for racing intrusive thoughts. Probably CBT, to be honest. Cognitive behavioral therapy. Just started Propranolol today. Nice. That Propranolol can help with the physical anxiety attacks. Lamictal for intrusive thoughts. It's not really used for intrusive thoughts. Lamictal is more used for depression. How does CBTI work in comparison to CBT? CBTI is just CBT focused on sleep. Like that's all it is. ASMR what they're eating. That's so funny. Yeah. Have you seen changes in people who have BPD that are treated successfully? Yeah. One of my friends is BPD, and so she went through a lot of therapy and stuff, and like she's able to maintain her relationships and friendships a lot better than she said she did in the past. like now she's a boyfriend, right? Like she's able to maintain some friendships. Like, I'm friends with her. She's on some meds as well too. So yeah, she came a long way from what she's told me. I did Lamictal with no success. Now I have no meds, but insane anxiety and trauma from the meds. What should I do? I feel like I've had anhedonia. It sounds like therapy might be the answer then, if there's that much anxiety. Doctor, what's your favorite psychotherapy modality? I mean, they're basically just different tools for different purposes and different patients respond. But I like CBT, and I like a lot more action oriented kind of therapy. And for example, so I just saw a patient today, and so she is working on uh, basically like she's going through a divorce, so she's working on, okay, how is she gonna bring it up to her partner, and so we strategized ways that she could do that. And so this, I liked it because it was a very like practical, like no nonsense kind of thing. Whereas I find with other clients, like they're not able to really do that. Like she's the type like, okay, just tell it to me straight, like blunt, and like I can handle it, I can work through it. But then I have other clients who have to be a lot more softer with and gentler and focus on how they're feeling, which is fine for that, right? But it's just not my favorite thing to do. So I like, okay, like let's do this. Like let's get to work. Like what are we gonna do? How are we gonna shift our thoughts around? How are we gonna accomplish? How are we gonna shift our goals, our priorities, our thoughts, our feelings? How are we gonna adjust all of these variables to accomplish the mission? That's how I think about it, at least. And yeah, so that's what I like. Do you see clients from any state? So I have a bunch of state licenses. So like I literally have a whole bunch. So yeah, best way is to, I mean, well, one, where do you live? But yeah, the best way is to just see my bio, and then you can book a consult from there. Certain degrees, Texas, yes. CA, mm-mm. Certain degrees of anxiety, depression, intrusive thoughts. Certain degrees of I can't even read. Certain degrees of anxiety, depression, intrusive thoughts are way too powerful for only CBT. Yeah, exactly. Then you might need something more intense. Yeah, that's why medications can help, because a lot. For example, my one OCD patient, she's like, yeah, I can't really do exposure therapy. It's too stressful for me. So she has to do the OCD treatment to like bring down stuff, and then yeah. Tim's. Also, I like your Robin Chuan avatar. Can I diagnose a consult even if I'm already diagnosed? Yeah, I see people for second opinions, second opinion consults all the time. Yeah, so pretty common, pretty common. What would you use? Would you use clomipramine in preteen? Probably not. I have no seizures, but I took Wellbutrin, had one. Yeah, it can cause it, so you might just be prone to it. How was your med school life? It was good. I wasn't like the stellar student by any means, but I had a life. I had social activities going on. Uh, I ate good. I went to the gym regularly. Sleep deprivation was not a thing for me, except during like maybe surgery rotation. But other than that, like I felt pretty happy going through it. Yeah. So yeah, but yeah, I think we've been yapping for about 70 minutes right now. So I think I feel myself getting tired. So now's the time to call it. So if you are a PMHNP, right, and you want to get coaching from me, like you want to really learn psychiatry, you want to learn from a psychiatrist, you want to discuss cases with me, and with all our community, then I would definitely recommend joining our coaching program. And now's the time to join, because we just dropped the price for 50%, and it's literally going to end at midnight tonight. Uh, because I did a promotion and we got way more successful. We went from 90 to 102 members in like 2 days. So it's been really good. So I'm going to end that at midnight. So if you've been sitting on the fence, like now is definitely the time to join. The yearly is 50% off. Otherwise, I hope that, yeah, you've been well. I hope you like this, and I will see you tomorrow. Are you in Illinois? Yeah, I do have an Illinois license actually. So if you want to book a consult, then the best place to do that is in my bio. That's the best place to see that. But otherwise, yeah, I'm glad you were on, and yeah, catch you tomorrow. Take care, my friend.